Maria and
Gina.
Reflect and Reset with Maria and Gina, your favorite show.
Yes.
Every Wednesday, 5 o'clock, and you know that we're here to bring you amazing information that is important to you, your family, and your loved ones. So, Gina, let's introduce our guest today.
So, we know, everyone probably knows by now that we have an amazing membership, right? A medical membership. And today we have Mitesh Patel, who owns Sunshine Pharmacy, which is right next door to us. And beautiful. And Sunshine Pharmacy actually gives all of our members up to 70% discounts on drugs. So keep in mind, we're always bringing these community partners to our members to be able to save them money because they're cash payers, uninsured. So, Mitesh, why don't you tell us a little bit about you?
Sure.
And how you get started in pharmacy and all about your company and stuff.
So a little bit about me. I graduated from St. John's in 2014. Became a pharmacist in 2014 and worked in the retail setting all my life since I was young. So I thought it was a great opportunity for me to help the underserved and take on this challenge of enjoy working with you and providing discounts, providing savings to patients that can't get them because of insurance and things like that. So we started here 2 years ago. It's been a great road so far.
Yes.
So we're really
We're
excited.
helping this company grow big time because of our patients.
Yes,
Yeah.
we're very thankful for Formé. It's a great relationship. So we're excited to continue.
Yeah, we love the fact that we can unite together for the good of the community.
Yeah.
In that, I know we empowered you by getting you busier and you doing the same thing with us. We work as a unit, and we wanted to thank you. Take this opportunity to really thank you because you're making an impact in the community, and from the bottom of our hearts, we really thank you for being there.
Drugs are out of reach for a lot of people, and even if they need a certain drug, like, excuse me today because I'm a little asthmatic today. So, but even for asthma patients that can't even have the right pump because it's too expensive, so they have to use something that might not even be the right medication for them. So this is how amazing this partnership is.
Yeah, it's wonderful. I mean, as everyone knows, drug prices aren't getting any lower. So we're trying to help as best as we can, especially for your members.
Well, thank you.
Yeah,
tell us the challenges that you see that people have, even the insured patients, right? When it comes to medication, because not a lot is covered.
Right. Yeah. So some of the greatest challenges
Speak a little bit more.
Some of the greatest challenges that we've seen is medication costs on new therapies for insured patients, new therapies for uninsured patients, just costing hundreds, thousands of dollars. And it's starting to become burdensome on them. So we work with the Formé members. We work with our insured customers as well to make sure that we're getting them the lowest cost on innovative therapies as well. So situations where Lantus has now cost $500, $600, we're now able to get brand name Lantus insulin for much less. Significantly less for all your members, so significantly less for cash customers. So we're able to provide those kind of savings by working with the manufacturers and developing relationships with them to provide those discounts for patients.
It really is amazing how they increase the pricing on some of this medication. That doesn't even cost them that much money, but they make it out of reach, these pharmaceutical companies. They make it unreachable for patients.
Oh yeah, and diabetic patients, we see it every day. Insulin that's been around for decades should not cost that much. Should not cost $500-$600 because it's been around for so long. There is no quote unquote research and development that has to go into it. So they're just trying to grab money at that. So we try to corner them and negotiate with them with lower rates for our patients and our members and the Formé members. So
that's awesome.
In diabetes, it's such a big issue. I mean, do you see a lot of patients with diabetes that are on insulin?
Oh yes, we see that a lot, and we see a lot of patients that will skip their insulin regimen because they cannot afford it. And we work with them. We try to provide them payment plans so that they're not falling behind in their regimen, they're not getting worse, and we're helping them manage it better because they're able to get inexpensive test strips to keep monitoring their blood sugar. We keep providing them more and more just to make sure they manage it on a daily basis, because that's the most important thing.
Sure.
They can take their medication, but if they do not know how their sugar is doing on a daily basis, they won't know if it's staying stable or getting worse.
Right.
So,
how do pharmacies help prevent the drug interaction, the allergies, right?
Mhm.
Or drug interaction, is that right?
correct.
Because that's supposedly an issue, right?
Yeah.
You mean if a doctor
People-
prescribes something and they're already on something else that could
That could,
adversely
right,
affect them?
Yeah.
right.
So we see that a lot, and we have great technology that works, that we've purchased from the beginning to make sure that we catch any kind of interaction for our patients, especially patients that we see on a daily basis or a weekly or monthly basis. We're now members of the community, so we develop relationships with these patients, and they've seen Dr. Smith, but then they come here to Formé and they see Dr. Middleton. And Dr. Middleton has them on a regimen that Dr. Smith didn't know about. And
Right.
that's not something that that's where we catch Dr. Smith's oversight.
Right.
And we're able to help prevent any kind of further issues down the line.
So let me ask you something, because it's something that we talk about and it affects us. Because we're so small, we have a tough time negotiating rates like with the insurance companies.
Sure.
Are you the same, like your rates for a drug would be higher than like a CVS because they buy in bigger volume? Or what kind of buying power do you have to be able to pass the savings along?
Right. So the buying power that we have is we work directly with the wholesaler, and we explain to them what our mission is. Our mission is to get low cost for our members, especially the cash paying community, because that community is struggling. They're not able to find those discounts from the big box stores that everyone goes to. There are programs out there that work, but they don't provide nearly as great a discount as we're able to provide it to them. So we're able to get the medication down to a list where we're able to make sure the patient can afford the medicine and stay on it on a daily basis, and stay on it on a regimen where we can help monitor them.
And if you think about it, I mean, there should be, the government or even the drug companies would want to help, because if the patients are not being treated, they're going to end up costing the system a lot more money.
Oh yeah.
I mean, a diabetic that is not getting the insulin is going to get very ill. They're going to end up in the hospital. They're going to, be there for days. I heard somebody was telling us, one of the executive director of a hospital was saying that it can cost the insurance company up to $10,000 a day to have someone in the hospital. So not.
But that's the insurance company, not the pharmaceutical company.
No,
Pharmaceutical companies make money no matter where you are.
Oh no, what I'm saying is that the pharmaceutical companies should work with mission-based, pharmacies like Sunshine, because they're making an impact, just like we talk about the work that we do.
Yeah.
We have patients that are coming to the urgent care, they're not going to the emergency room.
Right.
We have patients that are being seen for physicals, the preventive medicine, and we know that we're making an impact already.
Yeah.
We want to make an even greater impact, but the impact that we're making, so the government should want to help us.
Sure.
Because we are communicating, we do, even the Facebook Live that we do.
Yeah.
How many people, how many groups do you see that are actually taking the time every week, twice a week, to bring information that we know is going to impact the lives of the community?
Yeah.
Where we're educating them, where we're bringing you, we're discussing things that I know they're thinking that they might not know, and we're giving answers. And so everybody has to come together to help us.
Yeah.
We're the underdogs here.
Yeah.
And believe me, the insurance treat us like underdogs.
Yeah.
I mean, they don't really care about
No.
small practices
They don't
like
care.
us. And we, I used to work at a very big group, and I remember we have the power to negotiate. And Gina and I, get we're like rebels when it
Rebels,
comes to this
right,
because
right.
we're like, this is just not, this is
Rebel
so
round.
unfair.
Yeah.
Where, you know, I was negotiating a few years ago great deals. I come here and Gina and I are trying to really make an impact.
Just get Medicare
Yeah.
rates. Just
Yeah.
give us Medicare rates.
And
Yeah.
we cannot even do
Yeah.
that,
Yeah.
you know, and we're like, but it's a percentage that it's like ridiculous.
Oh yeah.
Yeah.
That they are only because we're so focused and we are so passionate about our mission that we keep going because we're not being paid enough.
Yeah.
And it's just so unfair, but yet we are making a difference.
Yeah,
and
we're
gonna
finding ways to help.
Yeah.
And just
Yeah.
on that note regarding medications,
Yeah.
you know, we've started a not-for-profit and we got the verbal okay from the IRS that we're going to be a 501c3, which is a charitable organization, tax exempt. So for anyone who wants to donate, but one of our missions is to be able to buy the medications that some people can't afford that they need.
Right.
So these are so many areas that we're trying to figure out how to
Yeah.
help people.
Right.
So like with you, right? So if you can we can buy these medications from you,
Yeah.
you know, at a much lower cost. We can distribute them to all these patients in need,
Oh yeah.
Yeah.
you
Yeah.
know, and it's unbelievable.
It-
Like,
it
we're
is-
finding the answers. We
Yeah.
are. Slowly.
We're going to find it, and believe me, it's not easy.
No, it's
It
not
easy.
is, you know, we work very hard, but it's when you have a purpose. You know, yesterday I was talking at the Rotary Club,
Yeah.
and I talked about purpose. You know, we have a purpose of making an impact,
Yeah.
and the three of us, obviously, and it feels amazing.
Yeah.
So we have to continue on this
Yeah.
journey.
Yeah.
And we're also going to help, you're going to help us with some vaccines.
Yeah.
So we're going to talk to Sunshine about how much they could charge our patients for vaccines because you may be able to get them cheaper than even we can.
Right.
And he can actually inject our patients for them.
Yeah.
So it'd be much less. So we're not looking to put the money in our pocket. We're looking to just, like to pass the savings off
Right.
to our members.
Yeah, and that's really important, especially a lot of people shy away from the upcoming flu season and upcoming vaccination season because they think it, you know, will cost them a good amount of money. And it's, you know, it puts not just themselves at risk, but it puts their entire circle at risk, their entire network of people they connect with at risk because as you can see, you know, vaccinations are very important in our lives.
Yeah.
Everyone needs, you know, everyone should be getting these vaccinations for the flu season coming up because the flu is very debilitating. And we want to make sure we do our part to get everyone in this community vaccinated to prevent any outbreaks.
That's
Yeah.
awesome.
Yeah.
And that is the flu season. I remember an infectious disease doctor that I know used to say like at the end of September,
Mm-hmm.
right? End of September
Is when you should be vaccinated.
when you should be,
vaccinating?
that's when people start vaccinating.
Mm-hmm.
But I mean, I like to do it in October,
Yeah.
towards the end of October. But that season is coming.
But
Yeah.
it's
So
around the
we're-
corner.
Yeah.
You know?
Time flies, I gotta
Yeah.
tell you. Talk to us about the brand and the generic,
The
the
difference.
difference.
Sure. So a lot of people have a misconception that when the brand is available, they think that's the only thing that works. But every day, new generic medication or new medications are going generic. Medications that have been very powerful, very effective for years as brand names are now much less, now cost significantly less, and are able to be provided to patients at a significantly lower cost.
Is it the same medication though? It's just a different
Oh,
name
yeah.
under a different label?
It's under a different label. More companies are able to make it doing simple economics and bringing the cost down.
But the whatever is inside the medicine,
Yeah.
is it
And
exactly the same or
so-
there are variations?
So the active ingredient is 100% the same. Everything else is 90% the same. So you're talking, you know, the only thing that may be different is a dye that's, you know, that maybe
That wouldn't affect.
that wouldn't affect
The result.
how the medication
Right.
works for you.
Right.
If the medicine doesn't work for you, then that's probably just the medicine. So we would
So it's
But-
not that it was generic versus the brand.
Yeah.
The brand wouldn't have worked either. They would have
Right.
spent more money on it.
right, and using the brand name, it puts more of a stress on the healthcare system, right? As an insured patient, you're putting more stress on the healthcare system. So that's why they are so reluctant for all our patients that, you know, that we're treating that are you going through MVP, going through Health First, going through Fidelis. We're, you know, they're all struggling to get medicine covered because it's a brand name, but that's what they want to do.
And some insurance companies don't cover the brand.
And yeah, they won't cover the brand.
They won't even cover it.
They won't even cover it because there's so many back end dealings and it's a very black hole. So
there's like one medication I think that I was on at one time that was like $115 for the brand, and then the generic was a $5 copay.
Mm-hmm.
I was like, you're kidding me, right? Give me the generic.
Exactly.
And it's ridiculous.
Especially when it comes to our Formé members, when we're able to provide discounts on a brand new generic medicine that came out, such as a new medicine that came out very popular for pain relief, Lyrica, for example,
right.
just went generic, made by the same manufacturer still. All they did was change the label on it on the outside bottle. Everything else is the same.
It's exactly the same.
So the same company.
Same company, they reduced the cost by 90%.
How could, which means that we're making 99% profit.
Exactly.
I was actually going to ask you, I'm like, wait a minute. If you think about it, insurance are pushing you out of the brand drugs. They're costing a lot more, so people are going to try to go and get more of the generic. So, but they're going to eventually lose business. But if they're doing what you're saying, that the same company, they're just changing label.
Yeah.
Wow.
But that shows you how messed up the system is.
Exactly.
How they're gorging all the prices, gouging the price. It's just not fair.
They have good lobbyists. You know, it's.
Well, maybe you should come work for us.
Yeah. Well,
you shouldn't be working for them.
That's the important thing that everyone should know. Always ask questions about your cost of medicine. No matter whether you're coming to Sunshine or going to the person down the street. Always ask, is there a generic available? Is there an alternative that will cost me less? Because until you ask, there is a quote unquote gag rule that pharmacists aren't able to provide that information.
So
we laugh at that. We laugh at that rule because we don't believe it. We don't believe it's ethical. Sunshine does not believe that's ethical. We believe we should do our part in the community to make sure that customers, whether they're members of Formé, members of the insurance company or not, they should be getting the lowest cost possible. Or it's an alternative.
So if there's a generic out there for some, you can't tell them that there's a generic available?
Technically no. But we tell, that's an insurance company rule that some insurances put on us.
But not the self-pay.
But not on self-pay. But state has backed us in stating that you can shy away from that rule. So we're going to do our part to make sure the community knows that there's medicine that will save you money and provide the same benefits.
See, this is why you guys have to go to Sunshine, because I mean, you're like us. You're mission driven, and you want to help the community. You want to help the people, especially if you have to come out of pocket for all this stuff. And like me, I'm on a lot of different medications. Mm-hmm. I mean, I'd be broke.
Yeah, it's not fair. It's not fair.
I'm going to ask you a question that it's going to be a little awkward, but what do you think of CBD in medical marijuana?
I think there's medical marijuana has shown its benefits, but they restrict it. You know, they want to control it because it's very important that it doesn't get out of control, which is understandable because, especially in New York, you know, we're very slow to changing our rules. Mm-hmm. So that's understood. CBD, there's a lot of great benefits, but a lot of it is very arbitrary. It depends on who you speak to. Mm-hmm. Some people say there's great benefits, some people say it's not that great. But we have found certain companies that have done legitimate tests to make sure that their product is effective. So we work with those companies to make sure we sell their products for those that want.
I was going to ask you, so can you sell CBD?
Yeah, so we started selling CBD. We find that a lot of people want it, especially for stress relief.
Yeah,
it's great.
Topical pain relief.
Yeah, we use it. I mean, right now, CBD is it's something that I know. I had a back injury and I took it. I didn't have to take pain medicine,
Yeah.
and I have 2 herniated discs.
Yeah.
And I took CBD, and I was able to take
Yeah.
the pain.
Yeah. And you probably got one of the reputable companies.
Yeah,
You always want to make sure,
that's the
Yeah.
key.
Well,
Yeah,
talking to the doctor's office, talking to Formé, talking to Sunshine. We'll make sure that you go to the reputable. I'm
Right.
sure you guys are doing the same.
Yeah.
thing.
yeah, and you know
right?
what the truth is that if you guys think you go on Amazon and buy CBD, you can't. The CBD
Yeah.
you're getting is like less than 3% CBD
Mm-hmm.
because they're not allowed to sell certain
Yeah.
quantities of
Mhm.
CBD online. So
Right.
yeah.
you're not. So if you think you go, oh, I'm ordering this great stuff online at Amazon, you're not getting the product that you should be getting.
Yeah.
Yeah.
And we
Exactly.
learned
We're
that.
learning a lot
Learning a
about
lot, yeah.
CBD.
Yeah.
It is something that we believe
Mhm.
in it. So yeah,
And Dr. Middleton is actually becoming certified for marijuana, medical marijuana,
Very
because it is a
Yeah.
need. It is a need for a lot of our patients that,
Mhm.
even with the medication issue, that could
Yeah.
replace some of the medications
Yeah.
to start.
I mean, those medications are that we've been used to taking, that people are now getting, the companies are now getting in trouble for the way they used to practice and promoting it. These painkillers are very dangerous.
Yes.
Yeah.
They're
Yes.
very dangerous. They're, some of our viewers today probably have some in their shelves, from a dental appointment.
Yeah.
Sitting there in their
Like
bathroom.
30 of them.
Yeah, it's
For-
because they used one and they got 30. They got
Yeah.
they got 30.
Yeah.
And those things are sitting there dangerous, just lurking. You want to make sure you take care of those. Take care of that, dispose of that appropriately. Take it to
What is the appropriate way to dispose of it?
So there's the best way to do it is go to your local police department. Local police department has a ask no questions box where you can remove all your patient data and dispose of medication right there. They will ask no questions. They will ask nothing, and you'll be on your way.
yeah, you don't want to have that at home, especially if you have young children and teenagers, and they,
Yeah.
like you said, because I know it happened to me a few times when I had surgeries. I wouldn't take it, and there was like, it would
So can I
expire
have
there.
No, not me, but I'm saying, if someone would say,
Yeah.
oh, okay, if you're not taking them, can I have them? I was
Yeah.
like, no.
Yeah.
Yeah, and it's unfortunate in the situation where this drug crisis that we're in now, the way we're not, we have to make sure that we keep this out of everyone's hands as best as possible, and that's very important that a lot of people don't discuss.
Do you, what do you do to make sure that you take care of those drug seekers, they're called?
Yeah.
Do you do ISAP?
We do iStop, so we make sure that patients that are getting.
What is iStop?
Sure. So iStop is a program that the state developed a few years ago to make sure that the patients that are getting these medications are verified within a state system. So all the medications that they get dispensed, it gets recorded with the state. The state tells you where they got the last medication, who prescribed it, how many, what day they picked it up. That way, a doctor will know not to write that prescription because this
So if
doctor.
they're coming in 2 days later for more,
Yeah,
they're doing something with it.
exactly, and they go to Dr. Smith and then come to Dr. Middleton. Dr. Middleton's gonna deny them right away, and then they go to Dr. Joe, and Dr. Joe sends a prescription to me because Dr. Joe didn't check that,
Right.
and we check it and we say, ma'am, we can't send that, we can't write that prescription, we can't fill that prescription, and
You do.
it's
So
a,
you're the
it's a,
second court, right?
we do a secondary check.
And
So
patients
sure.
might get pissed, because I know the ones that are seeking
Yeah.
drugs.
Oh yeah.
We had so many issues where they're screaming at us,
Oh yeah.
writing bad reviews. Meanwhile,
Yeah.
they just want oxys. They
Yeah.
just want those medications. And,
Exactly.
you know,
It's a
we have a
horrible
license on
addiction.
the line, and
Mhm.
the doctors have licenses on
Yeah.
the line, and
Yeah.
we're just not doing it.
Exactly, and it's as licensed professionals, there's so much that you can tell them, but as family members of these people, it's your job to do your best to support them, because that's really important. Because a lot of times they can't control it, and they just need the support from the family or
Yeah.
And a
friends.
lot of them go because they had surgery and they we're
Yeah.
placed on these painful medication, and I mean, there's medications to relieve the pain, but I'm like, there must be other, way to
Oh,
do
yeah.
But
this.
it's the high. You know, they get this high, and you know, they just want more and more of it.
No, but with the doctors, I think sometimes, I don't know. I think they're too easy to give some
an
of these
easy way out.
medications.
And
Patients
you know,
complain and they give it to them.
and in a situation in urgent care, I'm sure you see it, a dime a dozen a day. So it's
We're lucky actually.
Yeah.
We don't see that many here.
We also
but
don't give our per diem NPs and PAs the license to write those.
Okay.
So it has to go to Dr. Middleton.
Yeah.
Because we don't so if somebody coming in at night looking for something like this, our guy can't even write the prescription for it.
And if we don't know you, you're gonna get 5 days, 3 days or
3 days.
the minimum.
A day, right.
So that then, you can go to your doctor if that is the case. But it's, it's quite interesting. I mean, that you see an epidemic, as they talk about the opium epidemic in this area, especially in the affluent area.
Oh, yes.
And you see a lot of people trying to come to you that are drug seekers.
We do, but we've also created a reputation for ourselves, similar to the way you guys have, where we don't promote that. We're not a pharmacy that's going to work in that kind of space, because that's, granted, if I did, I'd be very lucrative.
Right.
But I don't want. That's not the right way. We were, we were taught to do things the right way. We were taught to do it, take it slow and be there for the community. We're not gonna provide, enable people. So
This is beautiful.
You know,
Unfortunately,
you're my pharmacy, so
yeah, my pharmacy too, and this is a little bit off topic, but I'll bring it to the closing. Where today I just went to a huddle. We have huddles with our staff every day, and Gina and I get to go to one once a week at least. And today I had the pleasure of being there, and we asked them, what are you grateful for? Personally in business, which is something that we're
that's how we
doing,
start our meetings.
starting our meetings. And I sat, I was sitting there watching everyone say about the mission and how they love being here and how they have formed this unity. And I told them today, I said, I'm overwhelmed. They actually brought me to tears. I was overwhelmed with joy and proud that we have worked so hard to build this team that understands and believes in our mission.
Yeah, great team.
And we have created amazing partnerships like the one with Sunshine Pharmacy. Like we said, it is obvious when you speak that we're speaking the same language. We're here for the community, and we're here for the community as well that does not have insurance, which is a community that is in desperate need. So, there is the saying of working together. This is my last words to you guys is that working together means winning together, and that's what we're doing here.
Yeah.
Your last words, Gina?
My last words are, if you guys don't have insurance, you gotta call us, because I mean, look, with partners like you and partners like Quest Labs, and we have an amazing partnership, and we just want to pass the savings on and people get the care that they need, without being worked off.
Exactly.
How about you, Michelle?
Well, we're just excited to be working with a team like you guys. When you guys started and brought us along, it's just been a fun ride so far, and we're excited to continue helping the community. We're excited new programs that we're going to be starting soon to get even more savings for the patients, and hopefully in the coming weeks you will be able to provide those right over to your members.
And you know what the truth is that it's very difficult in this day and age, like physician offices, with a little guy to stay afloat. Because you're considered the little guy, and we're the little guys, and the little guys come together, we become bigger guys, right?
That's why we love helping underdogs.
That's
it's
right.
Like,
We're underdogs, they're underdogs,
Yes.
and together we become a powerhouse.
Yes.
Wow.
So it's really great.
Thank you so much for joining us,
Of
but we also are grateful for you.
Yes.
You that are giving us the support out there and following us. Thank you. We know you could be doing anything else right now but watching us. But you choose to watch us, and we are grateful for that.
Yes.
Thank you so much.
Thank you.
Bye
Have a
bye.
good week.
Bye bye.